On October 24th, Prairie Mountain Health held a public meeting to update Neepawa area about the status of the new Neepawa Health Centre, which was announced in December of 2021. Along with representatives from the Health Authority, who discussed issues of staffing and transition from the old facility to the new, there was also a representative from the architectural firm to share the updated layout of the new facility, as well as show interior and exterior photos of the construction to show what progress has been made. Attendees were given an opportunity to ask questions at the event, and at the forefront of many people's minds was getting the province to reconsider installing a CT scanner in the new facility. While that isn't currently part of the plan, we learned that there is, in fact, space allocated in the facility for the equipment if that should change. Originally slated to complete construction in 2025, the facility is now expected to be handed over to PMH in mid-2026 and open to its first patients in late 2026 or early 2027.
Good evening. I'm Trina Slate, Chief Executive Officer for Prairie Mountain Health. Welcome tonight. We are pleased to see everyone here and look forward to sharing some updates on the progress of the new Neepawa Health Centre. Before I introduce our speakers, I would like to take a moment and share our land acknowledgement. Prairie Mountain Health facilities are located on Treaty 1, 2, and 4 territories, the original lands of the Dakota, Anishinaabe, Cree, Oji-Cree, and the national homeland of the Red River Métis. Prairie Mountain Health acknowledges the harms and wrongs of the past and is committed to providing culturally safe health care that is without racism and discrimination. We dedicate ourselves to moving forward in the partnership with First Nations, Métis, and Inuit individuals, families, communities in the spirit of reconciliation and healing. Now, I am pleased to introduce Matthew Baring, who is the architect for the LM Architectural Group, to share an update on the new Neepawa Health Centre. Welcome, Matthew.
Thanks everybody for coming out. Glad to see the turnout tonight. So we did a presentation like this about 2 years ago. How many people were in attendance for that? Good portion. Okay, good. Well, some of this will be similar because we were a decent ways into design at that point. Now we're a decent ways into construction. But we have some newer images. We've produced more documents and reviewing with the clinical staff and that. So we'll go through this, and at the end we'll have some time for questions and that. And Debbie will also be speaking towards the end with a bit more of the clinical update and the stuff that's actually important related to what goes on in this building. All right, let's jump in. So we'll start with a couple slides about the site and some of the current photos of where construction's at, and then we'll progress on from that. So I presume most people have seen the large building off of the highway there. The highway would be just down about the floor level on the ground here, because there will be some space before the actual property of the hospital itself, which aligns up with, I believe, is it Broadway that lines up into town, but is not fully connected through at this point. As we come in, coming from High Life, there is the connecting road that comes across. At this point, it extends to about the end of our site, and in the future, there is likely to be more connection across, but that's up to the town and as services and the rest of the area gets developed. The main public access into the site will be over here on the east side of the site. And it comes in and splits to having both an entrance right up to the front entry of the building here that has the south facing. So we have some parking here. There's also a direct line that comes around to the emergency department entrance. And so there's some public parking there and drop-off areas that are suited for that. As well as the ambulance garage, which is on the side of the emergency department and allows them to have direct access into there. A couple other spaces, and then I guess We have secondary access in, which allows for service vehicles, which will be coming to the loading dock area at the back. We have the staff parking over on this side. A couple other spaces we have out here. There is a decent-sized building that has the emergency generators for the building in it. And so they're in a separate space. It's slightly disconnected from the building for different reasons with code and the rest of that. We also have a small maintenance garage, and then we have a helipad that's over adjacent to the emergency department so that we can have access into there. One of the other interesting things in here, we have this large pad over on this side. This building is going to be fully electric, which is a pretty significant item for a building this size for healthcare in Manitoba to have. I mean, some of Hydro's power has a bit of carbon in it, but for the most part, operating-wise, it'll be a carbon-free building, which is pretty significant and pretty special. But to do that, to get that amount of power from Hydro, we're actually taking a high voltage line off of the power that runs down the east side of the site, and we'll have a substation, which is essentially a number of poles that take power off of there and then bring it down to the power level that will be used for the building. And so from there, underground, the services will run and connect into the back of the building where we have our services. All right, let's jump to our next slide. We'll take some images around the building. This is a view from the south where we can see the front entrance, and then there's a glass atrium type space that we'll look a little bit more as we come in. And just as we'll look at the plans and we'll go through them floor by floor, but just as you're looking at it, on our upper two floors, we have two wings of inpatient that have views out to the landscape and across the century here. And then off to the right here, we have a single-story area where some of the clinic spaces is, like dialysis and cancer care are off to that side. And then off to the back side of the building is the emergency that we'll see in a moment. We can jump to the next one. So this is a picture from, I believe, about a week ago, looking from a similar direction to that last image. So we have the main entrance coming in here. We have our clinic wing here, emergency departments over on the back side here, and then we have those two wings of inpatient rooms that are on the upper two floors. You'll see over here we have the white cladding on this side. That'll eventually work its way around and come right up to the front here. So that similar sort of finish here. It won't be, this is just the insulation we're seeing that's in behind there. And then we have each of the stair towers is clad in masonry, and so that's what all this scaffolding is around the front here is for as they do the masonry up the front of the building here. You can also see out to the back we have the helipad. Some of the assessments that we did in that was due to the predominant wind directions for both the helicopters landing and taking off, as well as the fumes not getting induced into the building system. Having it off to that northeast side helped for that for both of our predominant wind directions as we have that. And then off to the north we have the opposite is the golf course and the river and the lagoons across the river there. All right, let's jump to the next one. So this is looking from the south side. There are some landscaped forms that we have both on the south side and then around the north. Some of that will have planting on it, and also for both interest and for snow to retain some of that. The nice thing of this photo, we took it first thing in the morning, and you can see that there's nice fog down the valley to the north here. The next photo we're going to look at is, oops, sorry, you can just go back 1 second. Just on the west side of one of the wings here, we have an exterior patio space that will be able to be accessed when we look at the inside, just in this area here is the cafe that's open to the public, and then just adjacent to that is the staff lounge where people have lunches and that. And so that can flow out into a landscaped area that's just on the south side here with nice shelter from the building and be planted up. So we can jump to that slide. So this is the slide here. The trees will take a little while to get quite this big, but as we come into here, it is divided loosely into a staff side because they'll come out of their entry here, and then a public side with a bit of a divider wall, but reasonably it's all open and people can flow and mill around through this area. So we have some benching, some seating, and then landscape to work with that, and to have the building sheltering it from some of the winds and that as the trees grow up in that too. All right, let's take a look at the next one. So this is the same one looking from just as you're coming out of the cafe and looking out there towards the south. All right, let's jump to the next. So this is on the north side of the site where we have the emergency department. And so much of the concrete for here is already in, but it'll get developed further. And as we look at the floor plan, there's a connecting area from the front entrance over to the emergency department, because sometimes there's you need access between those. And then the diagnostic imaging will be accessed just off the side of that corner. Next slide. So this is looking at that, the current status of construction on that side. And so we've got most of the single-story portion is in, and then actually the back side of the building was the first area to get most of its cladding. And then you can see over here we have the ambulance garage, and then the walkway that heads out towards the helipad. And then in the back here we can see the generator building, which will eventually have a tall exhaust stack on the back to get the fumes from that up and above the building. So that will be going in shortly. Great. So our next slide, we have one more of the outside. This is just of the back of the building where the trucks come in, and just to the right of us is that generator building. So probably not too much interest from that one, but slid in there. All right, so next we'll go and we'll take a look. Oh, got numbers, sorry. I thought we were at the side. So we'll go through each of the floors and talk about these spaces, but just as an overview of what's in the building, we have 60 private bedrooms. All the bedrooms are private, no shared spaces, both for infection control, and that's current standards of how we build healthcare facilities. Those are a combination of medical beds, surgical beds, and then we have some specialty beds. So bariatric is for higher rate patients that has larger spaces, larger doors to accommodate people. We have some airborne isolation rooms for folks that have airborne infectious disease. And then we also have palliative care rooms that are able to support people in their end of life. We have an obstetrics department, which has 3 labor, delivery, recovery, postpartum rooms, so you stay in the same room the whole time, you don't get moved around. And then one of them has a water birthing tub in there to support that type of delivery. In the emergency department, we'll go through there. It has 14 treatment bays that range in acuity from trauma bays, regular care, and then some of the brief treatment bays that are for higher throughput, so you're able to serve people of all the acuity levels that come in the door. In the outpatient, we have 10 exam treatment bays. In cancer care, there are 6, and in renal dialysis, we have 9 treatment stations. And then up on the second floor, we have 2 operating rooms and 2 procedure rooms, so we'll take a look at that as we go through the floor plates. On our next slide, we have some of the just interesting stats. I won't go through all of these, but just to cover a few of them, the site is 39 acres. The floor area of the building is 180,000 over the 3 floors. We talked a bit about the fully electric building and some of the advantages of that. With the foundation, the building is held up on 822 piles that go deep down into the building, or into the ground, so that we don't move. We have 4,000 cubic meters of concrete, and the one that's kind of fun is the 400 kilometers of electrical wire is going into the building. There's a lot of electricity in a health center this size. Okay, let's jump to the next one. So those were the construction. This one's about some of the people. At the busiest time, which will be coming up fairly soon, we'll have as many as 350 people on site on a given day. And that's comprised of 62 trades and sub-trades that have been awarded to date. On the design side that I come from, we have a consultant team of 22 different firms. They're engineers, landscape architects, and that. It's way more than just me. We have the avionics that worked with the helipad, even the climate study that was looking at how wind moves, how some of the fumes from either the generators or the helipad, that we're making sure we're not bringing those into the building when they're running, sustainability, and even traffic related to some of the parking, and making sure that we are providing appropriate transports around the site. And then there's been, over the last, what are we at now? 4 years, a significant amount of public engagement. So we had 5 focus groups, 7 public surveys. We've had over 200 design meetings with well over, 68 clinical staff, but even more than that over the course of this time. We're up to 2 public open houses. You're a part of this, you made it onto the presentation. And then we've had 4 rounds of mock-up rooms where we will see a couple pictures of them, but testing out the spaces with staff to make sure that we have things in the right places, to catch if we are missing anything, and to go through that before we actually construct it. And then people will say, well, wait a minute, where is this? And why didn't you put that on the other side of the bed? So we'll go through some of that. All right, next slide, please. So this is the main floor. We'll go through the main floor and then second and third floor, and we'll zoom in a bit more because this is a bit hard to read. As we come in right here at the south-facing front entrance, we come into a central atrium space that specifically for members of the public, that creates a center point that's a wayfinding node that as you go to any of the apartments, they're all just a short step away from that, so it's fairly easy to find your way, and from there you can get to really all the public spaces of the building. So we'll first start by looking at the southeast corner, but just as a key wayfinding, then we'll look at the emergency department, and we do have the diagnostic services with x-ray and lab and ultrasound in the center here, and then we'll take a quick look at the clinic space that's in that one-story area just off the front of the building. Go to the next slide. So on this slide, we have some administrative functions and rehabilitation therapy on the south wing. We have that central atrium we looked at, which has the main bank of elevator cores. That was one of the first things you probably would have seen of the building going up from the highway, because it goes right up to the roof. We have our cafeteria and the kitchen that's behind that. So when we were looking at those images of the landscape patio, that comes out right from the cafe space. This orange area is the staff locker rooms and their lunch space and lounge, which is just adjacent to the public cafe area. And then we have our pharmacy and then a number of the other back of house spaces. One item that I didn't talk about in here that we were able to arrange it so that with the loading docks and back of house spaces, that a lot of the cart traffic and supplies that are moving around through the building are able to move through separate staff-only spaces, so that keeps it out of the public walkways and areas. There's a couple spaces that, especially as you get up into the upper floors, as you're going through an inpatient room, you're obviously going through the main corridors. And there are some supplies that will come over to the single-story clinic area, but for the most part, able to keep those in separate streams. All right, so let's jump to some images of this area. As we come in through the front door, we have the three-story atrium space, which has the glass that we saw on the outside. And so it's a fairly large space, but it's still fairly scaled with some waiting space and furniture in here. And then off of that, we have a registration that's just adjacent as you come in. And then just to the left of us will be the elevators, and then the cafe sort of behind where we're standing in this area. If we go to the next slide, we'll look at it from the other direction. So we have the elevator core. So as someone's coming in, if you're going to surgery, it's just up to the second floor, and it's right there. And then the inpatient is just off of the elevator on both sides. And so then what we're looking at down here is the cafe. We have the gift shop, and some other spaces as we move down that corridor. So as we jump to our next slide, we have the cafe itself. So we're looking back towards that entry, and so it has the survey component. And then in the next slide behind us, we have the cafe itself, and then it looks off to that patio. So the staff, if they were to get food at the cafe, they would be able to access through this door into their space. So there's a number of spaces that they can have their lunch in that, but having a space that they can decompress and relax and separate from the public area was identified as a key factor. All right, so as we jump to our next slide, we have the northern half of the building. And so our loading docks are over here, and flow into this green area is our back-of-house general stores in that. We have the laundry, and then flow into, these are the ground floor mechanical electrical services. A lot of the services are up on the top floor for bringing air in and having good access down through the building. But some things like the main plumbing service, the main electrical services, those are all down on this floor. In the center here, we have a core that we have the lab on the south side, and then the blue portion is the diagnostic services. So in here we have our main access from the front coming off of the public entry here with a small waiting room either for phlebotomy, and then we can also come into, we have the 2 x-rays, and then a couple spaces for ultrasound and stress testing and the rest of that. This is also set up so that from the emergency department, we have direct access into the x-ray. So that's part of the key location being between the public entry and that direct access from the emergency department. So in our next slide, we'll take a look at the emergency department. This is just an image of the entry here. So where we're looking at that corridor from diagnostic services is just on the side, and then above that we'll take a look next is the emergency or the operating suites. So that image we were just looking at was of the emergency department entrance. So we have a waiting room. We'll take a look at our triage rooms. They flow through so that they have direct line of sight out to the waiting room and who's coming in and understanding that. And then as people are seen, they can come through and flow into the main core of the emergency department. This emergency department is a nice size where we're able to do it in one loop. So there's a staff core in the middle there, and then around that there's really access to all of the treatment spaces. The larger ones here are the trauma rooms where the folks in critical care are seen. There's access for that right from the staff as well as from the front, and then as the ambulance comes in, there's that direct line to that space. And then for the faster stream of minor treatment, we have some rooms on this side. Some of them are in chairs for folks that don't need to be in a full bed. And then we have your typical treatment spaces around there with the one isolation room, and then special area for aggressive mental health condition spaces is off to here, where we have a bit more of a private space for someone who is in an aggressive state. The next image we'll see is basically just from that area, and so we're looking down the corridor on this side, and the main staff area is just on the other side of the walls. So this is the hospital is big enough that it's in different states in all different parts of the building. So this is a recent image of the emergency department. You can see we have the fireproofing on much of the steel in this area, which is required because of the fire rating between our floors, and they're starting to frame it in as we go through here. Okay, let's take a look at our next image. This is of the entry and the waiting and triage space within the emergency department. And so the reception here greets you just as you come in for initial registration, and then the day-lit waiting room. We have everybody facing towards the staff, which is a critical item in Manitoba, so that they can see and assess people if anything escalates while someone's in the waiting room. So that's why we have the glass triage rooms where they can have that observation, and as you go through the triage process, you can flow right through into the rooms. Next slide, please. So this is looking inside the emergency department where we have that staff work area, and it's really meant to keep open sight lines so that there's great observation of all the rooms that are really surrounded off of this space, and allowing staff to have open collaboration so you can see who's in need and what needs to be done, and be able to communicate easily among staff to have a collaborative team effort. All right, our next slide, we'll be looking at that single-story clinic space that's off of the, right off of the front entry. In this space, we have 3 key departments, which you can see by the colors. In the orange, we have the clinic component. In the red, we have cancer care. And then in the blue, we have the renal dialysis. And as you said, there are 9 spaces for renal dialysis, 6 treatment bays in the cancer department, and 10 spaces that are in for the clinic component. Most of them are off of a central area, but we do also have a couple of them that are off to the side. So if you had someone like a visiting specialist and you needed, they needed a couple treatment bays for themselves, they have a work area, and then these spaces for seeing people without disturbing sort of the general everyday flow of the clinic area. All right, so we'll take a couple images or renderings and shots of this area. So this is in the renal dialysis space. One thing you'll notice as you go through here, the move from an infection control standpoint is really to reduce the amount of curtains that we have. And so you'll see more spaces. And in the past, this might have just been a curtained off space between the bays. And specifically with COVID and the heightening measures towards infection control, we now have a glass panel between them, and trying to achieve that same separation and privacy in that, while still meeting the ever-increasing requirements for infection control. Okay, the next slide. This is over into the cancer care department. Another thing you'll see here is that we do have a number of bays that have patient lifts, so that's meeting staff needs, and then also able to support patients without having to go and get a portable lift and some of these other items in here. All right, next slide. Okay, so we're moving up to the second floor. As we go through this, we'll take a couple images of what it looks like as you're coming off of the elevator core, which will be most people's experience coming into the area. We have our inpatient in orange here, which is split up into two separate wings. So we have 12 on the south side and 18 on the west side. One of the key spaces off of there, which we'll have an image of, we have a traditional ceremonial room on the second floor, and then on the third floor we have another one that's a matching one that can be used as a spiritual room within the facility. In our pink area here, we have the obstetrics, so labor and delivery. And so we'll take a look at that space. And then this whole side of the building here is for the surgical suite. So on the south side, we have the pre and post bays where people are prepped, and then as they're coming out of surgery, where they recover. In the core here, we have the two larger ones are the operating rooms, and then the two smaller ones are the procedure rooms. Which are for some of the lower acuity surgical procedures. And then in the blue area, we have the medical device reprocessing, where devices are sterilized and that. We'll have one image where we're standing right about the doorway here, and we'll see what the status of that area is as we go through some of these images. All right, so let's jump through to the atrium. So here we're looking back towards the front entry down on the main floor. We have the surgical waiting room where you come in just off to the right here. The elevators are these two doors at the midpoint, and then that ceremonial room is just through those doors here. So we'll take a look at that next. So we have a space here where we've had consultation with elders and representatives from the Prairie Mountain Health about how to appropriately set up this space and to meet the needs of the community, and it can be used in a number of different functions. All right, our next slide here. Oh, this is a zoomed in image of the inpatient department. Within this, a couple of the special spaces within here, we have our isolation room on this side. We have our palliative care room with the family lounge adjacent to that. And then the rooms around the outside with the core support spaces down the center. And then some of the interesting things that we're doing in here is, if we look at this wing as an example, we have our central care desk, which is a bit larger where the staff can work and congregate, but then also we have some satellite touchdown spaces where they can be closer to the direct rooms that they are covering. So we have one at this end and then one at this end here. And then right at the entry, there's another space that as people are coming in would be the first desk that they would encounter. And then off of this, there's access between to the obstetrics department over here. Okay, so as we go to our next slide, we have an image of one of our inpatient rooms. And as you can see in here, we have the bed with the head wall. They're set up so that this side is the caregiver's side, and then the family side with the chairs and the recliner are out towards the window, and each room has a beautiful view out to the outside. It's a nice thing of going a couple stories up. Often if you're working on smaller facilities, you're all one story, so you don't get quite the view that we'll have out of some of these spaces. And then we have the doorway to the washroom off to the right here. All right, if we see our next slide. So in February, we did a mock-ups in the actual spot where the room's going to be of some of the emergency department spaces. And then in June, there were mock-ups again of a number of other key spaces. So this is one of the images where we're going through the inpatient room, and and sort of having a last say of where all the devices are on the head wall, where the different other elements are in the room before they start truly wiring in 60 of these rooms, to an assessment of it before that all moves together and happens. So lots of best practices that are really beneficial to the final outcome. All right, next slide, please. So we talked a bit about the obstetrics and the operating or the surgical suite. So we won't talk too much about that. As we go to our next slide here, we have a couple of the bays in the day surgery area where people are getting prepared for their surgical procedures. Okay, if we go to our next one, we have one of the images within the operating room, and so that'll we have the booms that we've been working through extensively that will support that, and the layout for the different procedures that will be happening in this facility. Go to our next one. This is actually an older slide that you guys would have seen 2 years ago, but I was just really impressed that the contractor, when they assembled this, put in the effort to make this look like it would actually be. Otherwise, an operating room is essentially just a large empty room with a bunch of carts that you move around. So this really helped to understand how the different pieces were moving in the site and how they would use it for during the actual procedures. Next slide, please. So this is that shot I was telling you. So in the emergency department, they're well along in the framing of the spaces. This here up on the second floor, so right above the emergency department, we have the medical device reprocessing, and really about where this red lift is where the operating rooms are. So this space very shortly will be getting filled in. And you can see over on this side we have the penthouse with a lot of the major mechanical equipment. So that has a second story above it with the fire rating, and then over on this side it's just roof, so it's not fire rated to the same degree. All right, next slide. We have the third floor, which the inpatient department is essentially the same as the floor below it, so that all of those spaces are laid out the same for staff as they are working in either of the units. And then the key difference on here, above the surgical department, we have the main penthouse where all the key air handlers are and where much of the building services are. And where this little door is, there was a huge hole in the wall where all of the key units came through, and then that's been filled in more recently. So next shot we have is of the zoomed in of the, yeah, you could go with that. We just talked about it. It's a larger version of the inpatient. On our next slide here, we have the inside the penthouse and some of the work that we have there. And so this room will be completely packed up with equipment in that. But one of the things I wanted to talk about on this, the infection control standards for building a hospital are incredibly strict, with a huge amount of coordination of who's working in what spaces and what you're allowed to do at different times. One thing you'll notice is the floor is remarkably clean, even at this early stage. That products are wrapped until they, to keep dust out and the chance of the contamination being in there. I didn't include a slide down in the clinic area, but even pallets of drywall, they are protected from any moisture, and they're fully wrapped until they start using the products. Another example, all of the ductwork is closed off, both as it arrives to site, but then at the end of every shift, they have to make sure that anything they were working on is sealed off, so that dust is both eliminated during the process, but not getting into areas to increase the life of the building. So they've done an excellent job of that. All the products are neat and orderly and tidy, and cleanup is happening on a significant basis throughout the duration of construction. So I believe that's about the end of my portion. We'll have questions in a moment or so, but as we get to the next slide here, I believe we're transferring over to Debbie and some of the comments on the important parts of the project.
So as you can see, since we last met, there's been a phenomenal amount of progress. We have been continuing to meet. So just not the clinical folks, I would say every group of staff that's going to be working in this new building. So right from nutrition services to the folks that are going to be supplying the stock, to the clinical staff, to the building maintenance folks. What we know right now to date, based on schedule, is that we're anticipating PMH will receive the building in the summer of 2026. And then there's a lot of things that need to happen once we get the building before we can actually have a first patient into the building. And that will be either late 2026 or early 2027. The clinical staff and the physicians have been very involved and engaged throughout this whole process and continue to be. As Matt showed you, we've had more mock-ups in the actual current hospital, the new one, in February and in June. And that was really fine-tuning the last parts of the design. So things like, did we have the electrical outlets in the right spots? Were they the right height for ergonomics? So we've had lots and lots of engagement, and so the design is pretty much complete. We have also finished the staffing model, and that is the full staffing model for the entire hospital. So just not clinical staff, but also the facility engineering staff, the nutrition staff, the cleaning staff. All of that model has been complete. And the equipment list, that is complete, but we're just doing some final reviews on it. Naturally, when we get into procurement of the equipment, things like accessories that we need to purchase, we'll be talking lots about that. So there's a lot of work that's taking place to be ready for when the keys are handed over and in preparation for when we can actually have our first patient day in. So our next steps, we've been having operational readiness meetings, and those will continue. So we've had one round with all of the staff to talk about how are they going to work in the new building, what is some of the new equipment that they're going to have, what are the training needs that are going to be required before staff can actually physically work in the building, so orientating them to those things. And then we'll start to develop the move plan. So there are two different things. But we're very much working on the operational plan right now, and we'll continue to do that. And then we'll shift into the move plan and what will that look like. We have a staffing plan, so we've been working with HR in terms of how we plan to onboard staff. We have developed a plan and are hoping to actually start onboarding some staff within 2025. We are developing an orientation and a training plan. So as I said, there's lots of orientation, lots of training with new equipment, new devices, new systems that are going to be in the hospital that we need to train staff before we can actually have it open to the patients. We anticipate that whole training plan and orientation will take anywhere from 3 to 6 months once we get the hospital handed over to us until we can see our first patient. So part of the work we're already doing right now is developing that plan and working it back so we can understand, is it 3 months, is it 4 months, is it 5, how many months is it going to take us? We're also going to have a phased opening, so concerns that I'm sure that you have is how are we going to staff that building? We have the same concerns. So we have a staffing plan that kind of goes plan A, plan B, but plan A is where we will move all the services that are currently provided in your hospital to the new hospital before we take on additional services. So when Matt talked about the 60 beds, in that phased opening, we will not open all 60 beds at the start. We'll open 30 beds. The ambulatory care area, where there was the outpatient treatment for people that come in for frequent dressing changes, for IV therapy, we will not open that on the first day. The renal unit, that will probably not open on the first day. So again, it's taking the services that are currently provided in the current Neepawa hospital, moving those services over to the new hospital, and then as staff get comfortable, and we'll reevaluate the HR plan, and so how many staff we have hired, then we will gradually open all those other services. It is important that we have an HHR plan, but equally important, the staff have to feel real comfortable in working in that new hospital and feel comfortable with the new services, but as not only the nurse services, but all the new equipment that they're going to be working with. So it's very important that we do really good training, really good orientation, get them comfortable in working in that new environment before we add on additional services. So there is going to be a phased opening. And I think that brings me to the end, and we'll open it up if anybody has any questions.
When you're talking about the phased opening, when we go to the hospital to get blood tests, is that going to be moved over early, or is that something we keep going to the old hospital for, and then we find out when?
Yeah, so that's the move plan. So the move plan is how are we going to move from the current hospital into the new hospital. Right now, we're saying that that move plan will hopefully take 1 day, maybe 2 days. But there will be notification to the public in terms of when do you go, where you still continue going to the current hospital, but then when you go to the new hospital for care. So a really good example is the emergency department. We absolutely need to keep that emergency department open. And then there will become a moment in time where then you will have services at the new hospital open. So there'll be things kind of open and transition for a little bit, for a few hours for the emergency department while we fully move over. But there will be communication to the public in terms of what that looks like. And also we'll have still staff there to redirect people if they happen not to get them the memo about what's happening. So that's the move plan. The phased opening is just meaning that, you know, we're not going to open everything that's new until we actually are fully comfortable in the new hospital before we take on additional net new services. Okay? Yes?
Can you give us head count numbers of the existing hospital and the growth that we're going to see in that on staff?
Yeah, so it's coming out to around 150 net new EFT. So that could be 150 new people. It could be less, depends on the rotation and what EFT, so if you work full-time, part-time, that sort of thing. But that accounts for everybody in the building, so it's just not clinical staff, it accounts for the facility maintenance staff, nutrition services staff, security, everybody that's going to work, so that number is all encompassing. Yes?
Are we going to have a CT scanner?
So that's come up and there's been a study done, and right now the data doesn't support, but there is a commitment from Diagnostic Shared Health to constantly reevaluate that.
So is there space set up for it?
Yeah, there is space that has been identified where if a CT was approved, where it could go. Yes.
Is the public access off 16 Highway, is that the only public access into the hospital, or will there be one off the top?
So I'll turn that to Matt.
Well, and I guess so to date, the gravel portion of the road has been run through from over by High Life, and it's up to the end of the property here. Our understanding is that the connection that runs straight out towards Breaker 16 is going to be occurring before construction is done. As to the continuance of the road to the west, I would have to refer to the town on that and the planning. The town is responsible for the construction activities off of the site. So I'm not sure of the full timing on some of those items.
Is there going to be an issue with traffic congestion on 16 coming into the hospital if there's an emergency vehicle or something?
So with the traffic planning that was done early on, within the site, having that looped road so that you can come from either direction, and in the direction that we're going, the ambulances coming in from the public side would not have to go past any crossing traffic, so you don't have somebody pulling out in front of them. So that was in there, and that at this point we have the 2 points of entry for coming into the site, and the intent is that it would eventually connect also to the west, so that there would be the essentially 3 different roads that come up to the hospital.
Are there plans for the old hospital? I'm sure.
Yeah, we don't have a plan right to date, no.
So when you do vacate that old building, is that still property of PMH, or is that now in the midst of, like, who owns that piece of property, I guess would be the question.
Yeah, my understanding is that's PMH property.
Can you talk a little bit more about the phased-in opening and when we can expect to see certain services within the new hospital?
So with the phased opening, everything that you do that currently happens in the Neepawa Hospital will be in the new. So emergency department, your lab services, 30 medical beds, surgery program, cancer care, maternity, all of those current services that are there today will be operational in the new building with phase 1 of opening. Phase 2 would be renal dialysis, the ambulatory care wing, which is right in the same area as what the renal area is in the cancer care area, so that's the ambulatory wing. So just that one section for outpatient ambulatory type care, that will be open. That's new to the Neepawa Hospital. And then the third floor, the additional 30 medical beds will not be open immediately. So once everybody's moved in and we're working, and we'll reevaluate the staffing plan, where we are at with the staffing, and that staff are comfortable with what the services and how the building's working and how they're working in the building, then we'll look at expanding those services, so opening those other 30 medical beds, renal dialysis, and the ambulatory care. If in fact our staffing is really good, then we could definitely move that along a little bit faster. But it's really important that staff get time to acclimatize themselves in the new hospital before we take on additional new services.
Is there going to be any overlap of services if something shows up at the wrong hospital?
So there could be, depending on the move plan, so we still need to work that through. But we want to keep that move plan as tight as possible so there's not confusion for you in terms of where you go for care. So we really hope to try to move everything on one day, but it might take us 2 days. But we'll make sure that there's really good communication to the public. We'll make sure that there's people still at the site that maybe, everything is moved, but people didn't hear, so we'll make sure there's somebody still at the old hospital to say you need to go to the new hospital.
Is there a plan to amalgamate, say, the administration and public health into the hospital as well, or that's not part of this plan?
So there's administrative offices there, but public health, no, that wasn't in the scope of the